There are a series of numbers that I think it's very important that my patients know. These provide metrics or ways to measure how someone is doing with their health, and they're a place to have a conversation about prevention.
One of the most important tests that we do to assess your diabetes control is checking your A1C.
A1C is the average blood sugar that you have had in the past 3 months.
And this value should be, in most cases, under 7%. If it's over 7, that means your diabetes isn't optimally controlled and you have a little bit of work to do. If your doctor has determined that you should be checking your blood sugars at home as well, your fasting blood sugar should be under 100 to 130. If you're checking after meals, your after-meal blood sugar shouldn't exceed 180. Blood pressure is a measure of your pressure in your circulation. It's measuring the elasticity of your arteries. And it's important for you to have normal blood pressure if you have diabetes, because if your blood pressure is high, it increases your risk of cardiovascular disease further.
When we're talking about normal blood pressure, we're talking about less than 120 over less than 80. When we're discussing elevated blood pressure, we're talking about 120 to 129 on the top and less than 80 on the bottom. Stage 1 high blood pressure or hypertension, it's 130 to 139 on the top or 80 to 89 on the bottom. When we're talking about stage 2 high blood pressure, we're talking about a systolic of 140 or greater or a diastolic of 90 or greater. You don't know if you have high cholesterol necessarily. You don't feel anything. So the only way to test it is through a blood test. When we're talking about a cholesterol profile or lipid panel, there are several different measurements that are important there. The first is the total cholesterol. For the average risk person, the total cholesterol should be less than 200. The LDL cholesterol, or so-called bad cholesterol, if a person has diabetes, then it should be less than 100 and possibly much lower. The HDL cholesterol is the, quote, good cholesterol, so we want that as high as possible, and it should be 60 or greater. And when we talk about the final measurement, these are triglycerides, and in a fasting specimen, we'd like those to be less than 150.
BMI, many people might not know this, but it's the relationship that your weight has for your height.
Normal weight is considered a BMI of 18.5 to 24.9. Overweight is considered a BMI of 25 to 29.9. And obesity is a BMI of 30 or greater.
That means that you're accumulating a lot of fat in your abdominal area, close to your heart, and that puts you at a higher risk.
These numbers are what the doctors use to decide how you're doing. So if your hemoglobin A1C is rising despite treatments, then your doctor may say, hey, look, we need to change this. Or if your cholesterol is rising, well, then you need to eat less of this or do more exercise. So if you know these numbers, you're more of a partner with your doctor in terms of these healthcare decisions.